I'm Jen Margolis. I work at Rush University Medical Center, and our cancer center is the Rush MD Anderson Cancer Center as of recently. I've been here almost 13 years in October with the bone marrow transplant team. Now it's more the blood and marrow transplant and cellular therapy team for as their outpatient navigator for that time period. I started out the first in this job, and now we have a team of 3 of us for the post-transplant bone marrow transplant navigator role. I originally was interested in oncology when I was going to nursing school, and then I got assigned to the bone marrow transplant unit down at University of North Carolina in Chapel Hill. And it was a small unit, 12 beds, great nurses, great team, and I worked as a CNA there during school. And so I ended up moving to Chicago, learning more, getting a job in more general oncology and hematology, and then kind of was brought here by a friend of mine who worked with this team here and really said they were great. So, and it's worked out. So I've been here, like I said, almost 13 years. Really was watching nurses. I first went to volunteer at a community hospital back in Raleigh, North Carolina. And again, it's kind of where I was assigned, and I ended up on a hospice unit attached to an oncology floor. And these nurses are awesome. They were crazy good. and I thought that's kind of what the direction I wanted to do. And some people say oncology is a calling. I don't think necessarily that, but I think it does take a certain kind of person to want to do this and go into this field. So as the outpatient navigator, we work in the clinic with our doctors side by side and other providers. And so we are in close contact with all of our patients, and outpatient is a really good place to see our patients doing well. And inpatient is very important as well. That tends to be where people are sicker. So it's nice to see outpatient. You're still managing some serious issues, but you're tending to see more people kind of getting better and then going back to their normal lives, which is really nice to see. And then I just had a patient, I think is 25 years out from her transplant, to where we're thinking, you don't need to see us anymore. So it just runs the gamut from really new, kind of fresh transplant patients to 20 some years out. It is an honor. It's out of my comfort zone for sure. But I think it shows what a good team we have here of nurses, and we're all kind of tightly knit, especially, I have my little transplant family, and then the person who nominated me used to work here with us in this team. And then we have our bigger kind of nursing and the cancer center team. That's my extended family, right? and then the cancer center, just in general, now I've worked here for so long, I know so many people. So it means a lot to kind of be recognized. And I think what it shows is that we all have such a good team. We can recognize each other and support each other. Because I could just as easily probably nominate, some other nurses here in the cancer center. It's just my colleagues have been kind enough to recognize, hopefully, some of my strengths and what I've been able to help with or do over the years. Really what I think is, again, out of my comfort zone, but I think it helps bring recognition to nursing in general, to cancer care in general. So anything we can do to kind of bring appreciation for nurses and what we all do, I think it's a good thing.